Did you know that some of the most common prescriptions taken for senior health might actually be hurting your memory? Today, we're uncovering 5 common prescriptions that cause memory loss in older adults and how you can protect your brain health as you age. If you've ever worried about dementia, Alzheimer's disease, or simply noticed signs of cognitive decline, this video is for you. Because while these drugs are often prescribed to help, they can quietly interfere with your senior wellness, energy, and even your elderly wisdom. That priceless clarity that only comes with experience. We'll talk about how to improve memory, support better health while aging, and share proven senior health tips that promote dementia prevention and long-term senior brain health. So if you care about staying sharp, preserving your independence, and keeping your mind strong for years to come, stick around. You'll learn which medications that cause memory loss you should talk to your doctor about, and what safer alternatives can help you maintain senior wisdom and lifelong brain health.
Memory, our most precious cognitive treasure. But for millions of seniors, that treasure is being quietly compromised, not by time itself, but by the very medicines meant to heal them. The startling truth? What many accept as just getting old might actually be reversible with the right intervention. Today's revelation could change everything for you or someone you love.
Before we dive into the 5 medications, let's understand how they affect memory. Certain drugs impair memory by altering brain chemicals or slowing down brain activity. There are 2 main types of memory: short-term working memory. Some medications make it hard for your brain to form new short-term memories. You might forget something you were told just minutes ago, while others dull long-term memory and cognition. Often, the culprits are medications that disrupt neurotransmitters, the chemical messengers nerve cells use to communicate. When a drug blocks or overstimulates these messengers, it can hamper your ability to focus, learn, and recall information. Many of these memory side effects are reversible if the medication is stopped or adjusted. However, problems arise when multiple memory-affecting drugs are used at once or for a long time. As Dr. Joshua Niznik of UNC School of Medicine warns, the biggest concern is when several are used concurrently, at high doses, or for long periods.
Your brain on medications. Like static disrupting a clear radio signal, these common prescriptions interfere with the delicate chemical symphony that is your memory. But here's what pharmaceutical companies won't tell you. In many cases, the fog can lift. The path back to clarity begins with knowledge. And that journey starts right now.
Let's talk about our first memory thief, benzodiazepines. These anti-anxiety medications include drugs like diazepam, Valium, and alprazolam Xanax. They work by calming brain activity, which is why they're used for anxiety and insomnia, but in calming the brain, they also dampen activity in key memory centers. In fact, benzodiazepines are sometimes used by anesthesiologists specifically to induce amnesia during medical procedures. Older adults are especially vulnerable because they metabolize these drugs more slowly, leading to buildup that can cause not just memory loss, but also delirium and falls. Dr. D.P. Devanand, a geriatric psychiatry expert, warns they're addicting and notes these drugs should be used only rarely in seniors. If you're on a benzodiazepine, talk to your doctor about alternatives like cognitive behavioral therapy for insomnia, SSRIs for anxiety, or natural approaches such as mindfulness meditation and regular exercise. Never stop these medications suddenly. They require careful tapering under medical supervision.
Benzodiazepines, the calming pills that steal your memories. What's that? You don't remember taking them? That's exactly the problem. These prescription tranquilizers don't just quiet an anxious mind. They silence the very neural pathways that form your memories. But hope remains. Safer alternatives exist, and your brain can recover when given the chance.
Our second memory thief, sleeping pills, specifically the Z drugs, like Zolpidem, Ambien, Azopiclone, Lunesta, and Zalplan Sonata. These target the same brain pathways as benzodiazepines and can cause short-term amnesia and confusion. Some people experience alarming episodes where they cook meals or even drive cars with no memory of these events later. The hangover effect can leave older adults feeling groggy and mentally fuzzy the next day. For alternatives, experts suggest trying non-drug approaches first. Good sleep hygiene practices, consistent bedtimes, limiting caffeine and alcohol, creating a dark, quiet sleep environment are excellent starting points. Melatonin, a natural hormone, can help reset sleep cycles with fewer cognitive side effects. Cognitive behavioral therapy for insomnia, CBTI, is actually considered a first-line treatment for chronic insomnia and can greatly improve sleep without drugs. If medication is absolutely necessary, doctors may use the lowest effective dose for the shortest duration possible.
Sleeping pills. The cruel irony, medicines meant to restore rest sometimes steal your memories instead. Ever woken up to evidence you did something the night before, but with no recollection of it? That's not normal aging. That's your medication hijacking your brain. The path to restful sleep doesn't have to sacrifice your memories, and science has proven better ways forward.
Third on our list, tricyclic antidepressants, TCAs, an older class of depression medication that includes amitriptyline, Elavil, imipramine, tofranil, and nortriptyline, Pamelor. Though prescribed less often now, some seniors still take them for depression, nerve pain, or insomnia. TCAs have strong anticholinergic effects, meaning they block acetylcholine, a neurotransmitter crucial for learning and memory. By blocking key brain chemicals, these medications can cause significant memory lapses and confusion. In fact, about one-third of people taking tricyclics experience some memory impairment. If you're on a TCA and noticing cognitive side effects, ask your doctor about switching to newer antidepressants. Many SSRIs like sertraline, Zoloft, or fluoxetine Prozac don't have the heavy anticholinergic properties that TCAs do. Non-drug therapies like counseling, exercise, or social activities can also boost mood without fogging your memory. Remember, you don't have to simply accept memory loss as the price of feeling better. Safer options often exist.
Anticholinergic effects. A scientific term for a startling reality. These medications literally block the chemical messenger your brain needs to form memories. When acetylcholine pathways are disrupted, the result isn't just drowsiness. It's stolen moments, forgotten names, and missed connections. But here's the hope modern medicine offers. Newer antidepressants exist that lift your mood without dimming your mind.
Fourth memory thief, anticholinergic medications for bladder control and allergies. This category includes drugs like oxybutynin, Ditropan XL, and tolterodine Ditrol for bladder issues, or diphenhydramine, Benadryl, and hydroxyzine for allergies and anxiety. What these share is their anticholinergic property. They block acetylcholine, critical for memory and learning. In older adults, these drugs have been linked to a higher risk of dementia over time, especially with long-term use. The memory issues may persist even after discontinuing the medication. Besides memory loss, anticholinergics can cause sedation, dry mouth, constipation, and even hallucinations. For alternatives, first ensure the diagnosis is correct. Sometimes simple issues like UTIs cause symptoms mistaken for overactive bladder. Non-drug approaches like pelvic floor exercises, Kegels, can significantly improve bladder control. For allergies, prefer newer non-sedating antihistamines like loratadine, or cetirizine or cetirizine, Zyrtec, which are far less likely to impair memory than first-generation options. The bottom line, recognize when a medication is anticholinergic and use it sparingly or find another way.
The silent thief. Anticholinergic medications don't just temporarily fog your thinking. They can accelerate cognitive decline over years of use. That nighttime Benadryl, that bladder medication, they might be stealing more than just your sleep or urgency. They might be stealing pieces of your very self. But modern medicine offers alternatives that treat the symptoms without sacrificing your memories.
Our fifth and final memory thief, narcotic painkillers or opioids. These powerful medications, including oxycodone, hydrocodone, morphine, and fentanyl, are prescribed for moderate to severe pain. They work by binding to opioid receptors to block pain signals, but these same pathways overlap with memory processes. Using opioids can interfere with both short-term and long-term memory. People on opioids often report mental cloudiness and trouble recalling information. In older adults, opioids can cause profound sedation, confusion, and even delirium. Recent research has even found a link between opioid use and higher dementia risk in older patients. For alternatives, managing pain without heavy reliance on opioids is crucial. Acetaminophen, Tylenol, is usually safer for seniors with mild to moderate pain. Non-drug therapies can be surprisingly effective. Physical therapy, gentle exercise, heat or cold therapy, and massage can alleviate pain without clouding the mind. Some find relief through acupuncture or yoga. If opioids are absolutely necessary, doctors aim for the lowest effective dose for the shortest possible duration. Always discuss with your physician if you feel an opioid is affecting your memory. Sometimes adjusting the dose can help. The key is to treat pain without sacrificing your clarity and alertness.
Opiates, the double-edged sword of modern medicine, powerful pain relief at the cost of mental clarity. What many seniors don't realize is that the very medication easing their physical suffering might be creating a new kind of pain, watching their memories slip away, one dose at a time. But breakthrough therapies now offer pain management strategies that preserve both body and mind.
Let's clear up some misconceptions. First, isn't memory loss just a normal part of aging? No, not to the extent that it disrupts daily life. While minor forgetfulness can happen to anyone, significant memory loss or confusion is not an automatic consequence of growing older. Often, there's an underlying cause that can be addressed, and medications are a big one people overlook. Scientists emphasize we shouldn't shrug off memory issues in seniors as just getting old without a closer look. Second myth, my doctor prescribed it, so it must be safe. While doctors weigh risks and benefits, they may not always explain potential cognitive side effects in detail. Many drugs we discussed are actually flagged in guidelines as potentially inappropriate for older adults due to their impact on cognition. A common misconception is that you must stay on a drug forever once prescribed. In reality, you should periodically review your medication list with your healthcare provider to see if each drug is still needed or if a safer substitute exists. Don't assume memory loss is irreversible. Check if a prescription might be the culprit.
The truth about normal aging, that persistent brain fog, those forgotten appointments and missed medications, that's not just getting old, that's potentially reversible. Cognitive impairment masquerading as inevitable decline. Modern geriatric medicine confirms sharp minds can thrive at any age when given the right conditions, and often that means rethinking the medications in your medicine cabinet.
Here's your action plan to protect your brain health. First, review your medications regularly with your doctor or pharmacist, especially if you've noticed memory changes. Identify if any are among the categories known to affect memory. Taking multiple drugs can have additive effects on cognition. Sometimes it's the combination, not one single pill, that dulls your thinking. Never stop medications abruptly on your own. Many can cause serious withdrawal symptoms if suddenly discontinued. Always involve your doctor in any plan to reduce or change medication. Ask about alternatives, both medical and natural. For each medication affecting your memory, inquire about different drug classes that don't penetrate the brain as much, or non-drug therapies like physical therapy for pain or relaxation techniques for anxiety. Use the lowest effective dose possible. Memory side effects are often dose-dependent. Monitor changes and involve others, sometimes loved ones. Spot cognitive changes before you do. And build lifestyle habits for brain health. Regular exercise, mental stimulation, and social engagement can build cognitive resilience. Better brain health comes through mindful medication management, and you deserve to stay sharp while managing your health conditions.
Your brain's defense strategy. Knowledge is your first weapon. Vigilance is your shield. And action, discussing alternatives with your doctor, is your sword. This isn't about abandoning necessary medications. It's about smarter medication management that honors both your physical and cognitive health. The greatest gift you can give yourself and your loved ones isn't just more years. It's more years with a sharp, vibrant mind to enjoy them.
Let me leave you with this. Many memory problems in older adults can be traced to common medications, and this is a problem we can do something about. The 5 medication types we discussed today, benzodiazepines, sleep aids, tricyclic antidepressants, anticholinergics, and opioids, are known to cause memory loss or confusion in seniors. If you or a loved one is on one of these, don't panic. But do be vigilant and discuss the risks with your doctor. Memory loss is not inevitable with aging. Often there is an addressable cause, and drug-related memory impairment is usually reversible when the medication is adjusted. Always put safety first. If you suspect the medication is affecting your mind, don't stop it abruptly. Work with your healthcare team to find safer alternatives. Your brain might just need the chance to operate without those chemical roadblocks. Take control of your health journey and keep your lifelong wisdom intact alongside your physical wellness. You don't have to choose between your medications and your memory. With the right guidance, you can have both. Effective treatment for your health conditions and a clear, alert mind to enjoy each day.
5 common prescriptions, steal memories, but now you hold the key to reclaiming them. This isn't just medical information, it's liberation. Liberation from accepting senior moments as inevitable. Liberation from choosing between physical comfort and mental clarity. The path forward isn't about abandoning medicine, it's about smarter medicine. Your memories, your life's greatest treasures, are worth protecting. Today's knowledge is tomorrow's clarity. Until next time, stay sharp, stay healthy, and remember, your best years aren't behind you, they're ahead, waiting to be remembered.